Coronavirus or the COVID-19 has infected more than 95,000 people worldwide and has caused a lot of panic amongst the public. Welcome back to the channel, guys. We are here today with another video on the COVID-19 that was said to have originated in China. Various public health officials have urged people to stop panicking and instead follow the various safety measures to stay away from the new novel coronavirus. So for this reason, we are going to give you a list of the do's and don'ts to check the spread of the virus. But before we start, we would like to remind you to please check our previous videos for various other information and do not forget to click like and subscribe. The coronaviruses is a family of viruses that include those that causes the common cold and more serious diseases such as Severe Acute Respiratory Syndrome and Middle East Respiratory Syndrome. And its infections have a wide range of symptoms including fever, cough, and breathing difficulties. Many people ask the question if face mask is of any help. To people with symptoms, yes, because one of the ways that the virus spreads is through droplets. But to those without symptoms, the mask is of no use since the virus is not airborne, which has been a common misconception so far. Now, let us move on to the list of the various do's and don'ts. Do wear a mask properly around others if you suspect you may have the virus. Make sure you follow the guidelines because the mask itself can be a source of infection. The World Health Organization has videos on when and how to use a mask. Don't reach for antibiotics because no matter how much you are tempted, antibiotics work only on illnesses caused by bacteria, and the coronavirus, as the name spells out, is a virus. Do maintain hygiene by washing your hands for at least 20 seconds several times a day using soap and water or a hand sanitizer with at least 60% alcohol before cooking or eating, after using the bathroom, and after blowing your nose, coughing or sneezing. Don't touch your eyes, nose or mouth without washing your hands because if you have somehow come into contact with the virus, touching your face can help it enter your body. Do follow respiratory etiquettes. Cough or sneeze into the crook of your elbow or a tissue and dispose of the tissue immediately in a covered bin whether or not you suspect COVID-19. Don't hang out with your family or pets if you suspect you have the virus. You need to follow the method of self-isolation in order to protect them. Remember to eat and sleep separately from them. Try to stay in one room and use a separate bathroom if possible. Do consider taking extra precautions and staying out of public places, especially if you're over 60 years old or have a condition, as there is a higher risk of developing this disease. As of now, the highest risk groups appear to be seniors and people with pre-existing conditions like heart disease, chronic respiratory diseases, and diabetes. Don't travel if you have a fever, and if you get sick on a flight, remember to tell the crew immediately. Do reconsider traveling to affected countries. The CDC advises against all non-essential travel to China and South Korea, and the agency even suggests postponing non-essential travel to Italy, Japan, and Iran as well. Don't panic because at this point, public health officials still say the risk of becoming infected with COVID-19 is low. Taking proper precautions such as washing your hands and making preparations are the best things you can do to stay away from the virus. Remember to learn about the symptoms and to stay away from people who are sick. The WHO has advised to maintain a distance of at least 3 feet between yourself and a person who is sick or suspected to be sick. Never hesitate if you are ever feeling unwell. Get yourself checked and get help to save yourself as well as others, and keep in mind that the most important don't is don't spread rumors and cause unnecessary panic. Thanks for watching, guys. Please do like, share and subscribe to support this channel and help us know your thoughts in the comments section below.